Great, and we've got a great queue of questions, so we'll get right to it. It looks like we've got about 17 minutes until the top of the hour, and let's dig in. So this first question, I'd invite any of you to chime in on. The question asks, how do you measure or evaluate success, inequity, and minimizing algorithmic bias in these fields? As Dr. Jackson mentioned, good intentions are not enough. So how do you evaluate how poorly or how well you're doing? And I would add to that, how do you do relative comparisons? How do you compare biased AI and digital phenotyping against also biased existing systems that are heavily reliant on humans? And is it possible that AI might be less biased and less bad than the existing alternative? And again, how do we measure any of that? Open it up to any of you who want to address that. Mason, you want to jump in?
Yeah, I'll just say I like that line about good intentions are not enough, and I'm talking about the predictions made in the commercial sector, and so the first step to ensure equality is to release the data. We have no information about the outcomes of these thousands of wellness checks, and so it's impossible to even begin evaluating them unless we have the information or some responsible party has access to the information. And then I think that with respect to suicide prediction, there's a very low bar because physicians are very poor predictors of suicide. They perform little better than chance. So it's not starting from a very low place. So there is some great potential there, but we need to actually have the data in order to make that comparison.
Would anyone else like to chime in on the question of measuring success or failure? Well, we can.
Sure.
Yeah, go ahead.
I do agree in terms of transparency about the data is an important first step, and just for understanding what's being dealt with. What I would add, and it's a slightly different spin on it. But I have, through my research, I've been having the opportunity to talk to a number of developers of digital mental health tech. And they've been bringing up this issue of sort of measurement and how they're sort of finding that, they may be using existing measures to validate or to use their, whether this is, useful for the diagnostic category. But a number of them really have been bringing up these questions about, maybe needing to come up with new metrics, new ways of evaluating the success, that in being able to sort of meet this particular diagnostic tool or survey of whether this treatment seems to work, they're saying it actually doesn't seem to be adequately reflecting the things, and this has come up in diagnosis and treatment surveys for decades, but is it really getting to issues of, are their lives better in ways that are meaningful, and that these are opportunities for trying to address this. And it's also, I think, a way of thinking about, how and when we're addressing things like bias or otherwise, also just thinking about the measurements themselves, whether there are a need for engaging sort of different ways of thinking about it and how they're employed within different systems. Again, that sort of issue of whether if you have an insurance company, whether their measures are really, benefiting, different populations in the way that we'd like to see. So I think that's another facet of it.
Yeah, it's great. And on that topic of engagement, I'd like to ask you, Dr. Jackson, this came a question for you. How would you advise researchers to begin when finding and approaching a community leader or contact for community engagement? And given, as you said, that not all members of an underserved population will be involved with a particular church or local business or community center, how can we engage with community leaders without excluding large parts of the community? So where do you start and how do you do it?
Yeah, so honestly, this is the heart of the work that I do at the Care Research Center, which is all about trying to quantify our attempts at equity. So I have a long and rather boring answer to the first question, but let me stick with the second one. And this answer is actually quite simple. So I'll give you the quick one, and then I'll kind of elaborate. So the quick answer is you need to know who it is that you want to talk to in a community. And the only way that you're going to understand that is if you recognize that no community is a monolith. So the same reason why I would say don't go to churches to find Black folks holds true for any community that you're trying to reach. So it's not as though I'm saying that you're not going to find anyone at a church. You're going to find people who go to church if you go to church. But you're not going to find an entire community. The same thing is true if you go through kind of civil services, if you go through hospitals, if you go through community health services. So you need to know who it is that you're trying to reach. And so you need to be very, very thoughtful about what I call the sampling frame. So usually we as researchers conflate the sampling frame, the people that we actually want, with the catchment area. So, for example, if we are trying to reach a diverse set of populations, we might deploy our work in Los Angeles without a clear idea of who in Los Angeles we would actually like to reach. So the first thing that you need to know is you need to have a very good idea of your sampling frame. So try to restrict on the basis of every factor that you want to understand. And usually that means you have to think more carefully about the demographic factors that you're actually interested in. So you're interested in all Black folks? Are you interested in Black people who are a little bit older? Are you interested in people who are at high risk for this particular mental health issue that you're looking for? Now, conflated with that is a lot of the things that we've heard other speakers talk about. So, we have to worry about the validity of certain measures that we're using. We have to make sure that is not biasing the groups that we're trying to find. So that said, once you have a very clear idea of who you're looking for, then it becomes much more possible to approach a community. And what you'll find is that if your community is well identified, there is effectively no wrong door. So, if you have a clear idea of who you want to reach and you go to a church because you don't know where else to start, usually the person that is your contact at that church environment will steer you to the right community that you're hoping to reach. So the idea is just to be thoughtful, just to be procedural and be mechanistic in your approach. And even if you are kind of only left with these ideas of going to a YMCA or going to a community center, usually having that much more precise definition means that somebody will point you in the right direction. And that means, that already sort of puts you on the right foot in terms of engaging with communities in a much more sustainable way. So you got to know where you're starting, and that usually makes all the difference in the world.
Thank you for that. I want to go to a question. I think it comes from the audience and picks up on things that both Mason and Chelsea and all of you probably addressed, which is this conundrum. The questioner asked, thinking about regulation, IRB regulation, the more strict and careful we make academic research, RE digital phenotyping, does that mean private companies will end up dominating in this area in a way that is entirely unscrupulous? That is, the reason people didn't do suicide, says the questioner, suicide research for so long is that it was too hard, meaning lack of progress in this area and more space for bad actors from the private sector. And Chelsea, I want to connect it to a point you made at the end, which is that some in the system on the technology space may say, we're not going to do that. We're going to take an ethical stand and not do that. Does that potentially create a space then where the unscrupulous come in and say, okay, you won't do it, but we will, and we'll just take it right to market? I'm wondering, Mason, Chelsea, if you could comment on that challenge of trying to get the regulation right so you don't create these moral hazards.
Sure, I can go first. I think especially, I've been thinking a lot about the role of refusal in kind of ethical design of things. And in my own work, there have been times when I've been offered opportunities and invested quite a bit of time in going down a path of preparing to do a study that I ultimately decided not to do. And at that time, that exact kind of phrase comes in my head of, oh, if I don't do this, somebody else is going to do it, and they're going to do it worse than I would have done it. So I really had to grapple with this. I think this is something that anybody who cares enough to turn down an opportunity will think about in terms of how impactful that choice is. And I think, generally speaking, I'm really invested in building up the capacity for academic researchers to be able to both be able to draw some clearer lines around what they're willing to do and what they're not to do, but also proactively come out and take a stand when some research that they've done is now being applied or used in a way that they don't think is okay. And I think that we can critique those things on both scientific terms as well as kind of like, you know, the much kind of fuzzier ground around kind of like our values as a collective. That's some work that I've done. We've seen some research. I worked with a group of folks where we decided to write an open letter debunking the use of some of the statistical techniques that we'd been working on to evaluate, do risk assessments. And we decided to together as a group of scientists and social scientists write a critique of other groups of both companies and researchers who were actually continuing that work forward. And so I think that's true that there's always going to be kind of the folks who are willing to kind of profit from and push forward research for which there is a market. But I think what we are less invested in now, I'd love to see us be more invested in moving forward, is actually in trying to at least offer a counter perspective or a counterpoint instead of hyper focusing on the applications that make us feel the best. Is also investing in harm mitigation as well.
Mm-hmm. Thank you. Mason, did you want to comment on that?
Yeah, that's a great question. And the scenario that was described in the question is exactly what has happened. We see internet companies increasingly stepping into the roles of healthcare providers, healthcare researchers, and in many cases, public health regulators, for example, in the way that they decide what types of health-related information should be posted and shared online through social media. And so that's why we need to fold some of these practices into the existing regulatory framework like FDA regulation. And this has been done before. 23andMe was regulated by, or was, caught the attention of the FDA when it first offered its practices. And I think the same course should be taken with the Facebook's program. But in some cases, we will need to invent new systems. I don't anticipate or suggest that Facebook should go through a university IRB. For example, we need some different kind of system. Of course, Facebook is trying to create that kind of a system through its oversight board for content moderation. That's not going to work. It's not truly independent, and we need something truly independent, science-based for content moderation and for these other types of algorithmic systems.
Thank you. We probably have time we can squeeze one last question in here, and it was another really highly rated question, which we can't do justice to in our 3 minutes, but we can at least put on the table, and maybe, Nicole, you could address it first, and then anybody else they want to chime in. The question is, as algorithms and other applications can be deployed not just at a national level, but at an international level, how should we think about global and local regulations and guidelines for development? What may be considered fair in one context may be considered biased in another. And another questioner asked the same thing: how can we ensure inclusion and reduce algorithmic bias when research is on a global scale and you just have such differences in populations? I know you've written some about regulations and principles here. I'm wondering how we address that challenge that these questioners have raised.
That's a really good question. I think a couple different levels. In terms of regulations, as different, sort of European context, U.S. context, have been working a lot on, different sort of principles, different areas of regulation, and that's one area where you could see where there's commonalities. But again, some of the work that already Dr. Jackson or Chelsea Barabas are talking about, in terms of even though they're talking about regulatory, there's ways of sort of bringing in processes of engaging different communities in order to get a better sense of what's appropriate for those communities.
Thank you. I've had challenging. So in our sort of last 2 minutes, let me just open it up to all 4 of you. What do you want to leave this audience with? What's the take home message. I've got a great, I see a chat going on too. Let me just turn it over to you. Maybe we'll just go in the order that we presented. So it'd be Jonathan, Nicole, Mason, and Chelsea, if you have any last thoughts as we wrap up.
Yeah, my last thoughts, I really love the questions that the audience had, and I'm so sorry that we weren't able to get to more of them. I think that for all of them, my advice is the same, which is that we must strive for empowerment over trust. So with trust, that there is usually a goal of conferring faith, and we, the desire for people to take a certain very particular narrow set of actions. With empowerment, we're basically handing over some of those tools and obviously some of the power for local communities and for larger clusters of folks to make their own decisions, and that can be with us or without us. So I think that if we continue to strive and build, especially striving for capacity building around empowerment, then we will have, I think, much richer and much more creative and much more sustainable set of solutions for all of these questions.
Thank you. Nicole?
I would just add, since a number of these technologies, they're really taking place in different domains. And as I said, they're outside of established frameworks. And, to go on what Dr. Jackson said, trust has been a buzzword in a number of these domains. Empowerment is very important, but also sort of flipping it and thinking about trust architecture, what's needed in order to actually be trustworthy. And that involves the principles we've been talking about, transparency, but also these processes for bringing different voices into the picture and being able to actually push back, not just have their voices in there, but also be able to say no, and to be able to have a foothold in designing and pushing back on the technologies.
Thank you. Mason?
I agree that trust is not enough. We need, above all else, transparency, but we also need inclusion, testing, scientific rigor, and respect for autonomy.
Great. Chelsea?
I agree with all of that. I have very little to add, other than perhaps just to harken back on this point of building to increase autonomy and people's ability to decide for themselves. I just really agree with that.
Well, thank you to all. What great words that we've left with, empowerment, autonomy, transparency. This is a really great panel. And we've somehow done it all by the top of the hour. So I want to thank our panelists, Jonathan, Nicole, Mason, and Chelsea. Thank you for sticking around and spending your Friday afternoon thinking about these issues. Please come find all of us. I think we're all easily findable on the line. And stick around now for closing remarks. I turn it over to the powers that be to take us home. Thanks, everybody. It was a really wonderful panel.